In Paris, the highly infectious Delta variant has led to an increase in children testing positive for COVID. A particular concern is the rise in children aged 5 to 11 testing positive, since that group is still too young to be vaccinated. The Illinois Department of Public Health's most recent figures show some 660 children in Cook County, ages 5 to 11, have tested positive for the week ending August 21st. The numbers have been steadily rising since the end of June, when just 29 children in that age group were diagnosed. Joining us now to share their insights on the impact of the virus on children is Dr. Tina Tan, professor of pediatrics and infectious diseases at Northwestern University's Feinberg School of Medicine. Dr. Tan is also affiliated with Lurie Children's Hospital. And Dr. Taylor Heald-Sargent, a pediatrician and infectious disease specialist at Lurie Children's Hospital. Doctors, thanks you both for joining us. Dr. Heald-Sargent, let's start with you, please. I understand that Lurie is seeing a rise in children with COVID. How much of an increase would you say you've been seeing?
So as it's been through most of the pandemic, we've seen the rates mimic what's going on with adults. So as the number of positive adults has increased, so has the number of positive children. And in the adult population, a lot of them can be vaccinated, but in the children they can't, so the rates are continuing to rise.
And Dr. Tan, would you say that this increase is mostly because of the Delta variant?
Yes, we know now that the Delta variant accounts for over 93% of the amount of COVID that's being seen in the community. So the vast majority of the cases are going to be caused by the Delta variant in the children.
And is the Delta variant necessarily more dangerous for children, Dr. Tan?
Not necessarily more dangerous, but definitely more transmissible. We know that because of its high transmissibility, individuals that are susceptible to COVID because they cannot be vaccinated are going to be more likely to get it.
Okay. Dr. Heald-Sargent, how severe are the symptoms for children who are being hospitalized?
So just to keep in mind, overall children don't get as severe of symptoms as adults, but we are seeing an increase in symptoms in general with the Delta variant. Most of these are more like your common cold, what we call our upper respiratory symptoms, cough, congestion. It might seem like they have their allergies. When they start to have issues with keeping fluids down or with their breathing, that's when they have to be hospitalized. And we've seen this all throughout the pandemic, that a certain proportion, thankfully a small amount of children compared to the amount that are testing positive, have to be hospitalized with these more severe symptoms. But as numbers overall start to rise, the numbers of children hospitalized are also rising.
Now, here in Chicago, we know that kids headed back into the classroom just yesterday. Here's Dr. Anthony Fauci and what he told CNN this weekend with Jake Tapper discussing vaccine mandates for children.
I believe that mandating vaccines for children to appear in school is a good idea. And remember, Jake, this is not something new. We have mandates in many places in schools, particularly public schools, that if in fact you want a child to come in, we've done this for decades and decades.
I should correct myself. That was on Sunday, not yesterday. But children under 12 not yet cleared for the vaccine. And here in Chicago, as I mentioned, students are back in the classroom. Dr. Tan, are you concerned that we could see a jump in cases because students are back in classrooms?
Yeah, we could see a jump in cases, but I think that if mask mandates are in place and other tiered mitigation protective protocols are in place, this is going to decrease the amount of disease that potentially could happen in the classroom setting, especially if all individuals that are eligible for vaccination are vaccinated.
We just heard Dr. Fauci talk about vaccine mandates in school. Dr. Heald-Sargent, is this something that that you think we should be seeing in the coming months when that is available next year?
I think it would make sense. We need to use every tool available to us to end this pandemic and to drive these rates down. Vaccines are our most effective preventative tool. Right now we're using masks because they're the most effective thing we have. Paired with vaccines, that's when we're really going to start to see things improve.
Dr. Tan, children under the age of 12, parents, the world over probably want to know, many do anyway, when their children in that age group will be able to receive the vaccine. What do we know about how soon that could happen?
So currently the trials are ongoing testing this vaccine in individuals under 12 years of age. It's expected that data from those trials should be available by the middle of fall. And if everything goes well, an EUA for the use of the vaccine in these children should be available by the end of the year.
And some parents might also be wondering, if we saw vaccines for adults roll out so quickly, why are children taking a little bit longer? What is the FDA? What are the experts? What are they looking for? What do they need to know?
So the FDA actually in July put out a request to both Moderna and Pfizer asking for additional safety information on the use of the vaccine in these children. And they also asked both of these companies to double the number of kids that they were enrolling in the 5 to 11-year-old age group. So because of this request and the request for additional safety information, this has pushed back the availability of the vaccine for a month or two.
Dr. Hield-Sargent, any reason to believe that there may be additional health risks for children with regards to receiving the vaccine? And would we expect that children might receive, of that age group in particular, that they might receive a smaller dose than adults?
So we know that children, in particular in this age group, do respond very well to vaccines. And so it would not be surprising. And what I've heard is it's kind of expected that they'll probably end up having a lower dose approved. And that should help with some of those side effects that are more inflammatory, such as your sore arm or the red arm. The rare side effects, the ones that are very concerning, we don't expect to be seen, just like we didn't see them very much with the adult population. And the guidance out of the advisory committees just yesterday reaffirmed that the heart risk and other risks are very rare and less than the risk of the disease themselves.
And Dr. Hield-Sargent, before I let you go, what would your advice be to parents regarding getting their children vaccinated when that becomes possible?
Just do it. Please go out, get your children vaccinated. I know all vaccines are not to be taken lightly, but that's why we have invested so much time and energy as a medical community testing these. We have not skipped any steps. We are making sure they're safe as possible, and I can't wait to be able to have my children vaccinated.
Super simple advice, borrowing from the famous Nike slogan, just do it. My thanks to Dr. Taylor Hield-Sargent and Dr. Tina Tan.
Thank you.
Thank you.